birds in flight, symbols of freedom and beauty. But did you know that these majestic creatures can sometimes carry a hidden danger? A danger that not only affects them but can also impact us? Today, we're diving into the world of H5N1 bird flu, a virus that's been making headlines and raising concerns worldwide. Let's break it down together. Meet Anwar, a poultry farmer from Southeast Asia. For years, his chickens were his pride and joy. But one morning, something felt off. Some of his birds were huddled together, their feathers ruffled, their eyes dull. Anwar's heart sank. He'd heard whispers of H5N1, a deadly strain of bird flu that had devastated nearby villages. His worst fears were confirmed when the vet diagnosed his flock with the virus. Anwar's story is just one of many. H5N1 isn't just a threat to birds, it's a public health concern that could affect us all. So what exactly is H5N1 and why should we care? Let's find out. H5N1 is a subtype of the influenza A virus named after two proteins on its surface, hemagglutinin H and neuraminidase N. First identified in 1997 during an outbreak in Hong Kong, this virus primarily affects birds, both wild and domestic. But here's the catch: it can jump to humans, and when it does, the consequences can be severe. How does it spread? H5N1 is highly contagious among the birds. It can be transmitted through saliva, nasal secretions, or even feces. Wild birds, especially waterfowl, often carry the virus without showing symptoms, making it hard to detect. When it reaches domestic poultry, it can spread like wildfire. Humans usually get infected through direct contact with sick birds or contaminated environments. Think poultry workers, farmers, or even people visiting live bird markets. While human-to-human transmission is rare, it's not impossible, and that's what keeps scientists on edge. What happens if a human gets infected? Symptoms can range from mild, like fever, cough and sore throat, to severe, including pneumonia and acute respiratory distress. In some cases, it can be fatal. Recent cases in the US have shown that eye redness or conjunctivitis is a common symptom along with respiratory issues. Who's at risk? Poultry workers, farmers, and people in regions where H5N1 is endemic, like Southeast Asia, Africa, and parts of Europe, are most vulnerable. But with global travel and trade, the virus can pop up anywhere. That's why prevention and control are so crucial. How do we fight back? It's a multi-pronged approach. Vaccination of poultry, biosecurity measures on farms, and public awareness are key. Scientists are also working on human vaccines, especially for high-risk groups. And if an outbreak occurs, quick action like culling infected birds can stop the spread. Know you've been a good friend. Anwar didn't just stop at saving his flock. He became a beacon of hope in his community, educating others about the virus and how to prevent it. Together, they stood strong against an invisible enemy. H5N1 is a reminder of how interconnected our world is. By staying informed, taking precautions, and working together, we can protect both animal and human health. So let's stay vigilant, stay safe, and keep our communities strong. Want to learn more about H5N1 and how to protect yourself? Check out the links in the description below. Don't forget to like, share, and subscribe for more informative content. Together we can make a difference.